Amber, thank you for joining me. So you've been using the Fluorodose from Centrix. Did you know about Centrix previously? What was your previous experience of using Centrix?
No, I'd never heard of Centrix before. Actually, it was like completely new to me. So I was quite excited to hear about a new kind of fluoride product which could be used in practice, because I was always using varnish beforehand anyway.
Okay, fluoride products can be used after professional teeth cleaning or prevention purposes. What material have you used previously?
So I've just always been using Durafat varnish. Kind of with every practice I've worked at, it just seems to be the product kind of recommended to be used, and that dentists want me to use as well.
Okay, and when would you use that varnish?
So like the varnish application really for me is for a lot of sensitive patients who have quite a lot of like dentin sensitivity. I might kind of suggest to pop it on and then get a prescription, or dentists might just, if they're seeing a patient first, might ask me to pop it on as part of my treatment and kind of recommend me to do it that way. Also at the end of kind of any deep cleaning as well, we tend to pop it on like the gums and the teeth just to give them a bit more protection.
Okay, so you use it quite regularly. It's quite a regular thing. Okay, so did you use a single dose product, or was it in a tube? How did it come?
It was always in a tube, and it comes kind of with a little dispatch, kind of, what's the word I'm looking for, a little pad, which gives you different types of kind of amounts, so you're always giving the right amount to the right people, which is pretty good, and it means you're not wasting a lot of the fluoride varnish.
Perfect. But in contrast, Fluorodose is packed in a lolly tray with a brush. So once you open the package, you mix the varnish with the brush, and then you can use it straight away. Does Fluorodose, using it this way, does it save you time?
Yeah, definitely, because it means that you don't have to worry about kind of putting the right amounts out to then use it. It's already there and it's easily mixed, and it means that it can all be disposed of pretty quickly as well, so you don't have to mess around with the different parts.
And is there minimal wastage?
Yeah, I would definitely say so, because you can just pop the brush back in the actual container itself, and that all just goes in the clinical waste, so it's all packaged together, which is really good.
Okay, so do you think the lolly tray is beneficial for treatment of children?
I think definitely. I think it would be coming across a bit more friendlier. It doesn't look as clinical, because the packaging is quite good as well in terms of being quite colourful. So I think it would be good, and obviously if you have some trickier kind of patients who might be kids and don't want to sit very still, it just means that you can mix it and apply it and it's already done.
Yeah, absolutely. So there are 5 different flavours with Fluorodose. What were your thoughts on the 5 different flavours, and which one was your personal favourite?
It was they're intense flavours actually. Like they really kind of take over the whole mouth. But I would say my favourite was the caramel, but a lot of patients preferred the melon out of all of them. They just said it was quite like fruity and different from the typical dental mint flavour.
Yeah, and what is the difference? Why is it an advantage to have so many different flavours to try?
I think it sounds really daft, but it personalises like experience. If you can personalise like fluoride application, it just means that like patients are involved in their own treatment and they can have like a choice of what's going on their teeth, and it means if they don't like a certain flavour, sometimes the Durafat can be quite, I don't know, like caramel banana flavour, and a lot of patients hate it, so it's quite good to give them the option.
Okay, perfect. So would you recommend Fluorodose to other dental professionals?
Yeah, I would definitely recommend it, just because they have the variety of like the flavour of it, also the ease, also just because it's like a great product and patients seem to really like it as well, so I would definitely suggest it to other people.
Perfect. And just lastly, what was your favourite aspect of Fluorodose?
I think the ease of using it, like I say, you don't have to kind of take anything out of tubes or containers. It's already done and like pre-mixed pretty much, so you can just pop it on. So the ease of it is definitely good and saves a lot of time.
Perfect. Well, thank you, Amber. Thank you for taking the time to talk to me and talk to me about Fluorodose.
You're welcome.